Hey everyone, and welcome back to Coffeesodes.
Yeah,
Can you believe it's already our 5th episode?
I know. It's amazing.
Time flies when you're having fun, right?
That's right.
So today we're diving into something pretty big,
Mm.
AI in healthcare.
Yeah, it's a hot topic for sure.
It is. And to help us navigate all of it,
Yeah.
we're taking a deep dive into some recent research, actually.
Okay.
A systematic review of research from the past decade.
Wow. A whole decade.
Yeah, a whole decade. Trying to look at, not just the hype, but like
Right.
what's really going on with AI in healthcare.
Yeah. What are the real implications of this? Not just the what ifs.
Exactly.
What did this research actually have to say?
Yeah, so what can you tell us about the study that we're looking at today?
Well, this review was published just this month, actually,
Oh, wow.
by Awkward Hitch and their team.
Okay.
And they looked at a ton of studies from the last 10 years.
Okay.
To try to get like a big picture view of, how AIs and machine learning are being used in healthcare.
So not just one application, but like
Yeah.
across the board how AI is being used.
Right. Everything from diagnostics
Okay.
to treatment planning to drug discovery to admin tasks.
Wow.
Really impressive in its scope.
So what were some of the things that really jumped out at you from this?
I think one of the most striking things was just how many different ways
Yeah.
AI is already being used. It's not just a futuristic concept.
Yeah.
It's happening now in hospitals and clinics.
That's amazing. What are some examples?
So one area where AI is showing a lot of promise is diagnostics.
Okay.
We're seeing algorithms that can analyze medical images,
All right.
like X-rays, MRIs,
Huh?
with incredible accuracy, like sometimes even better than human radiologists.
Wow, so AI could help us catch diseases like earlier
Yeah,
and more reliably?
exactly. And early detection is key for treatment.
Right, makes sense.
Okay.
What other areas are seeing a big impact?
Well, another area that's really cool is personalized medicine. AI can analyze tons of patient data,
Okay.
like their genes, lifestyle, medical history,
Uh,
to basically develop a custom treatment plan.
so it's not just one size fits all anymore.
Right. It's tailored to you.
Wow, that's incredible.
Yeah, it could totally change how we treat a bunch of conditions from cancer
Wow.
to heart disease, even mental health.
It's like a custom-made suit,
Yes,
but for your health.
exactly.
Wow, that sounds super promising.
It is. And then there's drug discovery.
Okay.
AI can help us go through mountains of data
Okay.
to identify potential drug candidates
Okay.
and speed up the development of new therapies.
Wow. So AI could potentially help us find cures
Yeah.
for diseases that are currently incurable.
It's possible.
Wow.
Because AI can analyze those complex biological pathways and identify,
Yeah,
targets for new drugs much faster than we can.
that's incredible.
Yeah.
But I imagine there's some challenges too, right?
Oh, absolutely. I mean, one of the big ones is data quality, because AI algorithms are only as good as the data we feed them.
Right. So it's not just about having a lot of data,
Right.
but the right kind of data.
Exactly. And that's hard, especially in healthcare, because the data is
Right.
often like scattered around in different systems.
Makes sense.
And then there are privacy regulations to think about too.
Right, so it's not just a technological challenge, it's an ethical one.
Absolutely. And then there's the transparency issue.
Okay.
Some AI algorithms, particularly the ones that use dup learning, are really complex.
Yeah,
And it can be hard to understand how they reach their conclusions,
even for the experts.
even for the experts.
So we might have an AI system making a recommendation,
Right.
but we don't know why,
Yeah. And that's scary in healthcare.
right? Because these are big decisions.
Yeah. Yeah.
Life or death sometimes. So we need to be able to trust these AI systems,
Right.
and that trust comes from transparency.
So it's this balance of harnessing this amazing power of AI.
But making sure it's used responsibly and ethically.
Exactly. And that means thinking about not just the tech itself,
Mm.
but the social and the ethical and the legal stuff around it.
So we're not just talking about algorithms and data,
Mm-hmm.
but the human context.
Exactly. And that's what makes this so interesting to me. It's not just about the tech,
Yeah.
but about how it impacts our lives, our health, our society.
And speaking of impact, there was this one study in the review that really caught my eye.
Oh, yeah.
It was about how AI could help personalize healthcare,
Oh, interesting.
leading to more tailored treatments, better outcomes.
Yeah, that's exciting.
Yep.
Tell me more about that study.
So this study was by Katirai and their colleagues,
Okay.
and they actually looked at the perspectives of a patient and public involvement panel in Japan.
Okay.
on AI and healthcare.
Interesting. And what did they have to say?
They had really high expectations for AI to actually help reduce disparities in healthcare.
Oh, wow. So they saw it as a way to make things more equitable.
Exactly.
That's really cool. In what ways do they think AI could help?
They felt that AI could help improve hospital administration,
Okay.
optimize resources,
Yeah.
and enhance access to care for people in remote areas or people with disabilities.
That makes sense. If AI can help streamline things and allocate resources better,
Right.
and even provide remote consultations that could really bridge those gaps.
Exactly. And they also hoped that AI could personalize healthcare,
Uh-huh.
leading to, more targeted treatments and better outcomes for everybody.
It's a great vision, but, we were talking about bias earlier.
Right.
We have to be careful with these AI systems
Yeah.
to make sure they're designed fairly. We don't want to make those disparities worse.
Right. It's not enough to just throw technology at the problem.
Exactly. We have to think about how we use it and
Yeah.
who benefits.
One of the researchers actually said something that really stuck with me. They said, the somewhat blunt tool of technology, as it stands, will need to evolve some way before the culture of clinicians and patients will accept it.
That's powerful.
Yeah, it really highlights that we need this ongoing dialogue.
Right. We can't just shove technology down people's throats.
Yeah, we have to involve clinicians and patients and the public
Yeah.
in developing and implementing AI
Absolutely.
to make sure that it actually meets people's needs.
And addresses their concerns.
Exactly, and that this involvement is genuine.
Yes.
Not just
A box to check.
yeah, exactly a box to check.
We need real trust and transparency around AI in healthcare.
Absolutely.
And that takes open communication and a willingness to listen.
I think that's a great place to pause.
It's interesting to think about how AI might actually change the roles of healthcare professionals.
Yeah, that's something I've been wondering about too.
Mhm.
What kind of shifts are we talking about?
Well, imagine if AI took over a lot of the routine stuff that clinicians do now, like,
Okay.
Analyzing images, reviewing lab results, even pre-screening patients.
So doctors and nurses would have more time for actual patient care.
Exactly. More time to listen to patients, understand their concerns, develop treatment plans.
It's like AI could be this amazing assistant,
Right.
helping them be more efficient and effective.
Yeah, that's a good way to put it. And it frees them up
Yeah,
to focus on the human side of care.
right.
The empathy, the intuition, the judgment, the things AI can't do.
So it's not about replacing human clinicians,
Right.
but about supporting them.
Exactly. Augmenting their skills and allowing them to work at the top of their game.
And I guess that could lead to new ways for healthcare professionals and AI developers to collaborate.
For sure. I mean, you'd need doctors and nurses working with the people creating these AI systems
Yeah.
to make sure they're actually useful in clinical practice. Absolutely. It has to be a two-way street.
Yeah.
AI developers need to hear from clinicians about the real-world challenges. And clinicians need to be trained to use AI effectively and ethically.
Like a partnership,
Yeah,
a synergy
I like that synergy.
between human expertise and technology.
It is, and that could lead to some really big advances in healthcare.
Speaking of advances, one of the studies really highlighted how important it is to integrate AI carefully into the workflow.
Oh, that's so important. Which study was that?
It was by Peterson and their team in Sweden.
Okay.
They talked to healthcare leaders about the challenges of implementing AI,
Makes sense.
and they kept coming back to this need for a systematic approach.
Yeah, you can't just plop an AI system down
Right.
in a busy hospital and expect it to work miracles.
It's not plug and play.
No, you have to think about how it fits in with how things already work, how it impacts everyone's roles, how to make the transition smooth.
And the researchers found that healthcare leaders often ran into resistance
Yeah.
from staff who were hesitant about new technology or worried about their jobs.
That's understandable. Change is scary, especially something as big as AI.
Yeah.
People might think their jobs are going to disappear or
Yeah.
feel like they're not being included in the process.
Right. And it's crucial to address those fears.
Absolutely.
Be transparent about the goals of using AI.
Yeah.
Provide support and communicate clearly with staff.
And it's not just about preventing negative stuff.
Right.
It's about showing how AI can benefit everyone.
Exactly. Like if AI can take over some of the admin work,
Yeah,
clinicians might have more time and energy for patients,
exactly. And that's what matters most, using technology to enhance the human touch in healthcare.
not replace it.
Yes.
One thing that really stood out to me in this review
Yeah.
was how much emphasis they put on patient and public involvement.
Oh, that's so crucial. We can't forget that.
These technologies are meant to help people.
Exactly. And there was a study by Lamans and their team in the UK
Okay.
that really highlighted this. They did focus groups with public collaborators.
That's interesting. What did they find out?
The participants were really clear that they wanted transparency and trust
Yeah,
when it comes to AI in healthcare.
makes sense.
They wanted to know how it's being used, what data is being collected, how their privacy is protected.
Well, of course, people have a right to know how their data is being used.
Yeah, especially health information.
Absolutely. And they were worried about bias in the algorithms, too.
Yeah, we've talked about that.
Right. We need to be very careful about that.
And they also wanted to make sure there's always a human involved.
Yeah. They didn't want to feel like they were being treated by a machine.
Exactly. It's about finding that balance
Right.
between technology and human connection.
The researchers also found that people were actually eager to learn more about AI.
Oh, that's good.
Yeah, it shows that they're open to it.
Yeah. If it's done the right way, transparently, and with a focus on improving care.
Right. It's not about just telling people AI is good.
Yeah.
It's about showing them how it works, explaining the limits, involving them in the conversation.
Absolutely. And that means we need collaboration.
Yeah.
We need doctors, patients, ethicists, policymakers, AI developers all working together.
It's a complex landscape, but it's also really exciting.
There's so much potential for AI to improve outcomes, increase access, change how we think about health. I couldn't agree more, and it's conversations like this
Yeah.
that will help us navigate this new world responsibly.
It's amazing to think about how much of this comes back to data.
Oh, absolutely. Data is everything for AI.
Yeah, without good data, even the most amazing algorithms
Right.
aren't going to do much.
It's like, trying to build a house with no wood or bricks.
Yeah, yeah.
You might have a great architect, but without the materials,
Right.
you're not going to get very far.
It's a great analogy. And in healthcare, we're talking about really complex data.
Oh, yeah. Incredibly sensitive stuff.
No. Yeah, it's not just numbers. It's people's lives, their medical histories, their genetic information.
Right. All the things that make up a person's health.
And that brings up so many questions like,
Yeah.
how do we collect all this data responsibly?
Yeah.
How do we keep it private and secure?
Mm.
And are we using it to help patients or just to benefit corporations and researchers?
Those are the big questions, for sure. One study really dug into this.
Which one?
It was by Pumplun and their team in Germany.
Okay.
They looked at what influences clinics to adopt machine learning for diagnostics.
Makes sense. So what did they find? What were some of the biggest roadblocks?
Well, one of the biggest was data quality.
Okay.
Healthcare data can be messy. It's often incomplete or inconsistent or even inaccurate, and that makes it hard to train AI algorithms well.
Yeah, if you're training an algorithm on bad data,
Right.
you're going to get bad results.
Exactly, and that's a big problem for patients.
Yeah.
Imagine an AI making a diagnosis or suggesting a treatment based on bad data. Yeah, it could be life or death, so we need really strong systems for data governance.
So hospitals need to invest in better ways to manage their data.
Absolutely make sure it's accurate and complete and consistent.
And it's not just about the technology.
Right.
It's about the people, too.
Absolutely. Healthcare workers are the ones collecting this data.
Yeah.
So they need to be trained how to use electronic health records properly, how to spot mistakes,
Makes sense.
how to make sure the information they're putting in is accurate and useful.
So data quality, it's a tech issue, but it's also about culture.
Yeah, healthcare organizations need to prioritize data literacy and hold people accountable for the data they're handling.
Another big challenge the review talked about was data privacy and security.
Oh, yeah, that's a huge one, especially with all the data breaches we hear about.
Absolutely. People are right to be worried about sharing their health information.
Of course, especially if they don't know how it's being used or if it's being kept safe.
It's valuable information, both to researchers and to criminals.
Exactly. We need strong protections.
This study by Lineage and their team really got into this.
Oh, yeah. They had experts from all over the world talking about AI in primary care.
And I'm sure they also talked about the ethics of using AI in healthcare.
Oh, definitely. One of the biggest concerns was bias in the algorithms.
Yeah, if the data used to train these algorithms is biased, the results are going to be biased too.
And that can lead to unfair or even harmful treatment for certain groups.
Exactly.
Yeah.
It's not enough to just have a lot of data. It has to be diverse data.
Right. It needs to reflect the real world.
This other study by Sun and Medallia looked at how people view AI in China.
Oh, interesting.
Yeah, they were looking at the public healthcare sector there.
So how did cultural differences play into it?
Well, they found that people in China had different opinions about using AI for cancer management compared to people in Western countries.
That makes sense. Different cultures have different values and beliefs.
Yeah, and we have to be aware of those differences when we're developing AI systems.
We can't just assume one size fits all.
We have to be sensitive to different cultures.
Absolutely. And be willing to learn from those different perspectives.
And we have to remember that AI is changing all the time.
Right. What we think is ethical now might change as the technology gets better.
Yeah, so we need to keep talking about this.
Right. Have these conversations and adjust our ethical guidelines as we go.
And involve the public in these discussions.
Yes, this isn't just for the experts to figure out.
This deep dive has been so interesting.
It has.
It's clear that AI has huge potential to revolutionize healthcare.
Absolutely.
But we have to be careful
We do.
and really focus on doing this ethically.
I completely agree. AI in healthcare isn't just about data and algorithms.
Wow.
It's about people.
Yeah, using technology to help people in a way that's responsible and fair.
And that benefits everyone.
So what do you think about all of this? What excites you about AI in healthcare? What worries you? Let us know. You can find us on social media or leave a comment on our website.
Thanks for joining us on this deep dive into AI in healthcare.
It's a complex topic,
It is.
and it's changing fast.
But there's so much potential.
Thanks for listening to Coffeesodes. We'll be back next week with another deep dive.
See them.
Until then, stay curious and keep those coffee cups full.